The bathroom. For most of our lives, it's been a place of routine, of privacy, of quiet solitude. A room we enter and exit dozens of times a day without a second thought. We slip into the shower, step out onto the tile, and bend over to pick up a dropped towel on autopilot. It's a space we believe we know intimately, a safe haven within our own homes. But what if we told you that this very room, this familiar sanctuary, transforms into one of the most dangerous places in the house as we age? Particularly after the age of 70, the bathroom becomes a stage for a silent, often overlooked health crisis. The statistics are sobering. According to the Centers for Disease Control and Prevention, every single year, over 3 million older adults are treated in emergency departments for fall-related injuries. And where do the majority of these falls occur? You guessed it, the bathroom. But falls are just the most visible danger. Behind them lurk other risks, cardiac events, infections, and medication errors, all stemming from common, seemingly innocent habits we've practiced for a lifetime. The body at 70 is not the body at 40. It's a body of wisdom and experience, but it's also one where reflexes have slowed, bones have become more fragile, skin more delicate, and the cardiovascular system more sensitive. A slight drop in blood pressure when standing up, a moment of dizziness from steam, or a minor slip on a wet surface can have consequences that are not just minor injuries, but life-altering events, hip fractures, traumatic brain injuries, and a devastating loss of independence. The good news? This crisis is almost entirely preventable. Geriatricians, cardiologists, and physical therapists are united in their warning. By identifying and changing a few critical habits, we can dramatically reduce these risks and protect our health, our independence, and our quality of life. In this vital documentary-style exploration, we will delve into the 5 most dangerous bathroom habits that every individual over 70 must stop immediately. This isn't about fear-mongering, it's about empowerment. It's about equipping you and your loved ones with the knowledge that doctors wish everyone had. We've consulted medical guidelines, geriatric research, and expert opinions to bring you a comprehensive guide to transforming your bathroom from a hazard zone back into the safe haven it should be. So, whether you're watching this for yourself or for someone you love, pay close attention. Your next trip to the bathroom could be the safest one you've taken in years. Let's begin with the most critical hazard of all. Habit number 1. The unsupported step out of the shower or tub. This is, without a doubt, the single most dangerous routine in the bathroom for seniors. It's a complex maneuver that we take for granted, but it involves a perfect storm of risk factors. A wet, slippery surface, a high step over an often rigid tub wall, a shift in body weight onto one leg, and a simultaneous need for balance and coordination. For an older adult, this simple action is a high-stakes athletic event happening multiple times a day. Let's break down exactly why this habit is so perilous, from head to toe. First, the physiological challenge, orthostatic hypotension. Even before you move, the warm, steamy environment of a shower causes your blood vessels to dilate, a process called vasodilation, which can lead to a drop in blood pressure. Now, when you go from a reclining or sitting position, like showering on a bath chair, to standing upright to exit, your body must perform a delicate dance to maintain steady blood flow to your brain. This is governed by a reflex called the baroreceptor reflex. With age, this reflex can become blunted. The result is a condition known as orthostatic hypotension, a sudden drop in blood pressure upon standing. It causes dizziness, lightheadedness, and even a brief blackout. Imagine that wave of dizziness hitting you just as you're lifting your leg over the tub edge, standing on one foot on a wet, curved surface. The outcome is almost inevitable, a catastrophic fall. Second, the physical environment. A slippery, confined space. The surfaces in a shower or tub are designed to get wet. Soap, shampoo, and conditioner residues create a slick film on porcelain, acrylic, or fiberglass. The bottom of your foot, potentially softened by warm water and maybe even a little soapy itself, has significantly reduced traction. The coefficient of friction, a physics term for how grippy a surface is, plummets. Furthermore, the tub itself is a confined space. A fall here isn't a gentle slump to the floor, It's a violent collision against hard, unyielding surfaces, the tub wall, the faucet, the shower controls, or the glass door. The impact points are often the hip, the head, or the ribs, leading to fractures and serious trauma. The devastating consequences of a fall. We need to understand what a fall truly means for an older individual. This isn't a skin knee. For a person with age-related bone density loss, osteoporosis, or osteopenia, a fall from standing height can be life-altering. Hip fractures, perhaps the most feared outcome. Over 95% of hip fractures are caused by falls, usually sideways onto the hip. The surgery required is major, the rehabilitation is long and painful, and the loss of mobility and independence is profound. Tragically, studies show that among elderly adults, up to 25% die within 1 year of a hip fracture due to complications like pneumonia, blood clots, and infections. For many, it represents a point of no return in their ability to live independently. Head injuries. A blow to the head can cause a traumatic brain injury, TBI, or a subdural hematoma, a bleed on the brain. These can be insidious. Symptoms might not appear until hours or days later. For someone on blood thinners, a common medication for seniors, the risk of a serious bleed is drastically higher. Other fractures. Wrist fractures from trying to break a fall are extremely common, as are fractures of the pelvis, spine, and upper arm. Each one brings pain, surgical risk, and a long, challenging recovery. The psychological fallout. Post-fall syndrome. Beyond the physical breaks, there is a deep psychological fracture. A bad fall can shatter a person's confidence. They develop an intense fear of falling again, a condition known as tophobia. This leads to a vicious cycle. Fear causes them to reduce their physical activity. Reduced activity leads to weaker muscles, poor balance, and stiffer joints. This physical decline actually increases their risk of falling. It's a cruel, self-fulfilling prophecy that can rapidly accelerate a decline in overall health and well-being. The doctor recommended solutions. So, how do we dismantle this danger? Doctors and occupational therapists recommend a multi-layered approach to safety. 1. The non-negotiable grab bars. This is the first and most important line of defense. Do not confuse grab bars with towel racks. Towel racks are designed to hold the weight of a towel, not a falling human. They will tear out of the wall with catastrophic consequences. Professionally installed grab bars are anchored directly into the wall studs and can support hundreds of pounds. You need at least 2. One vertical bar on the wall near where you step and slash out, to hold onto as you lift your leg. One horizontal or angled bar on the side wall, to provide stability as you stand and move within the shower. 2. Embrace the seat, shower chairs, and transfer benches. This is a game changer for independence and safety. A shower chair allows you to sit while bathing, eliminating the risk of standing on a slippery surface and the dizziness that can come with it. A transfer bench is even more secure for those with significant mobility issues. You sit on the bench outside the tub, then slide across it on a stable seat until you are safely inside the tub enclosure. Your legs never have to step over the tub wall. This completely eliminates the most dangerous part of the process. 3. Create a grippy surface, non-slip mats. A textured, non-slip mat on the floor of the tub or shower provides essential traction underfoot. For the bathroom floor immediately outside the shower, a water-absorbent, non-skid rug or mat is crucial to prevent slipping on wet tiles. 4. The simple pause. Before you stand to exit, develop the habit of pausing for a moment. Sit on the edge of the shower chair or tub, take a few deep breaths, and ensure you don't feel dizzy or lightheaded. Then, use the grab bars for support as you rise slowly and deliberately. Eliminating the unsupported step isn't about admitting weakness, it's about exercising wisdom. It's a proactive, powerful step towards preserving your strength, your independence, and your future. By investing in a few simple tools and changing one deeply ingrained habit, you can neutralize the single biggest threat in your bathroom. But the dangers don't end once you're out of the shower. The next hazard we need to discuss is one that turns a simple, daily act of hygiene into a potential trigger for a cardiovascular event. Your safety and independence are priceless. If this guide brought you value and opened your eyes to the hidden dangers in your home, please please do us a huge favor. Smash that like button and subscribe to our channel for more vital content that empowers your health and well-being. This information is too important to keep to yourself. Share this video with your friends, your family, anyone you care about who is entering their golden years. You could literally be saving them from a life-altering accident. What was the most surprising habit for you? Let us know in the comments below. And tell us what other health topics you'd like us to cover next. You've navigated the exit from the shower safely. Now, let's talk about what happens during the shower itself. For many of us, there are few pleasures greater than a long, hot, steamy shower. It soothes aching muscles, calms the mind, and feels like a daily reset. But after 70, this comforting ritual can place a silent, significant strain on the most vital organ in your body, your heart. Habit number 2, taking excessively long, hot showers. This danger is less about a slip and fall and more about the internal, physiological stress that extreme heat and humidity place on an aging cardiovascular system. It's a danger you can't see, which makes it all the more insidious. The cardiovascular roller coaster. To understand the risk, we need to follow what happens inside your body from the moment you turn on the hot water. Vasodilation, the great expansion. As the hot water hits your skin, your body's primary response is to cool itself down. It does this by dilating or widening the blood vessels in your skin in a process called vasodilation. This brings more warm blood to the surface to release heat. Think of it like opening all the windows in a hothouse. The blood pressure plunge. This massive expansion of your blood vessels creates a much larger container for your blood. However, your blood volume doesn't instantly increase to fill it. This leads to a sudden drop in blood pressure, a condition known as vasodilation-induced hypotension. It's similar to the orthostatic hypotension we discussed in Chapter 1, but triggered by heat instead of posture. The heart's panicked response. Your body detects this dangerous drop in blood pressure instantly. To compensate, your heart must work much harder and faster to try and maintain adequate blood pressure and, crucially, blood flow to your brain and other vital organs. Your heart rate spikes. This is a state of increased cardiac workload. For a young, healthy heart, this is a minor fluctuation. But for an older adult, particularly one with underlying and perhaps undiagnosed heart conditions, this combination of low blood pressure and a racing heart can be a trigger for serious events. For individuals with coronary artery disease, where the heart's own arteries are narrowed, the sudden demand for more oxygen-rich blood, from the heart beating faster, can outstrip the supply. This can lead to chest pain, angina, or even a heart attack, myocardial infarction. For those with arrhythmias, irregular heart rhythms, the stress can provoke a dangerous episode. The drastic shift in blood pressure can also be a trigger for a stroke in vulnerable individuals. Furthermore, the steamy environment reduces the amount of oxygen in the air you're breathing, which can add to the strain, causing lightheadedness, dizziness, and shortness of breath, all of which increase the risk of a fall within the shower itself. The hidden risk of burns. Cardiovascular risk is the primary concern, but it's not the only one. Aging skin is thinner, has less fatty tissue for insulation, and is far more vulnerable to injury. The nerve endings can also be less sensitive, meaning your perception of hot may be dulled. What feels pleasantly warm to you can actually be scalding hot enough to cause a second-degree burn in a matter of seconds. These burns are serious, painful, and incredibly slow to heal in older adults, creating a high risk for infection and other complications. Doctor-recommended solutions. The goal here is not to give up showers for cold baths, but to adopt a strategy of moderation and awareness. The Goldilocks rule: make it warm, not hot. This is the simplest and most effective change. Dial down the temperature thermostat on your water heater to a maximum of 120 degrees Fahrenheit, 49 degrees Celsius. This is hot enough for a comfortable shower but prevents scalding. If you can't adjust the heater, be meticulous about testing the water with your hand or elbow, which is more sensitive than fingers, before getting in. Shorten the session. Think of your shower as a functional clean, not a spa experience. Aim for 5 to 10 minutes. This limits your exposure to the stressful environment and reduces the overall strain on your heart. Ventilate, ventilate, ventilate. Always turn on the bathroom exhaust fan before you start the shower. If you don't have one, leave the door slightly ajar and open a window if possible. This helps clear the steam, improving air quality and oxygen levels, and reducing the overall humidity and heat of the room. Listen to your body. This is non-negotiable. If at any point you feel dizzy, lightheaded, short of breath, or your heart starts racing, get out of the shower immediately. Sit down on your shower chair or the closed toilet lid and rest until the feeling passes. Do not try to power through it. The lukewarm finale. A trick recommended by many cardiologists is to end your shower by gradually turning the temperature to lukewarm or cool for the final 30 seconds. This helps constrict blood vessels gently and normalize your body temperature and blood pressure before you step out, smoothing the transition and reducing the shock to your system. By tempering the heat and shortening the time, you protect your heart from a silent burden. You transform a potentially risky activity back into the simple, safe act of getting clean. It's a small change in routine for a massive payoff in cardiovascular safety. Once you're out of the shower and dried off, the next task seems mundane, drying your feet and perhaps trimming your nails. But as we'll see in the next chapter, this routine act of self-care is the origin point of one of the most common and serious medical complications for seniors. The shower is done. You're safely out and you're dry. Then it happens, you drop the soap. Your towel slips off the rack. The toilet paper roll escapes your grasp and tumbles to the floor. It's a minor moment, an everyday annoyance. Your automatic, lifelong response is to simply bend over and pick it up. After 70, this automatic response, habit number 3, bending over from the waist, needs to be deleted from your memory. What seems like the most natural movement in the world becomes a high-risk maneuver that threatens your spine, your head, and your overall stability. The biomechanics of a dangerous move. To understand why this is so dangerous, we need to think like an engineer and look at the physics of the movement itself. When you bend forward at the waist with straight legs, a movement known as spinal flexion, you are essentially turning your spine into a long lever. The weight of your head, neck, and torso, which is a significant portion of your total body weight, is now cantilevered out in front of your base of support, your feet. This places an enormous amount of mechanical stress on the weakest parts of your back, the lumbar vertebrae and the discs that cushion them. The pressure inside these discs skyrockets. For an older spine, which may already be affected by osteoporosis, brittle bones, or osteoarthritis, degenerated discs and joints, this excessive pressure can be the final straw. The risk of vertebral fracture. In someone with osteoporosis, the bones of the spine can be so fragile that this simple bending motion can cause a compression fracture. This is a tiny break or collapse in a vertebra, often causing a sudden, sharp pain. These fractures can lead to a permanent loss of height, a stooped posture, sometimes called a dowager's hump or kyphosis, and chronic, debilitating back pain. The risk of a slipped disc. The immense pressure can also cause a weakened disc to herniate or rupture, pressing on spinal nerves and causing pain, numbness, or weakness that can radiate down the leg, sciatica. The dual threat, a fall and a head injury. The spinal risks are severe, but the immediate danger is even more acute, falling. Bending over disrupts your balance in 2 critical ways. Shift in center of gravity. Your center of gravity moves forward, away from your stable base. This makes you inherently unstable. Blood flow to the head. You are suddenly placing your head far below your heart. This can cause a rapid, dizzying rush of blood to your head, cephalic rush, or, conversely, a pooling of blood away from the brain when you stand back up, leading to orthostatic hypotension and dizziness. This dizzy spell, combined with the unstable position, is a perfect recipe for a forward fall. And in a bathroom, a forward fall means your head is on a direct collision course with the unforgiving edge of the bathtub, the vanity counter, the toilet bowl, or the hard tile floor. The risk of a concussion, a traumatic brain injury, or severe facial lacerations is extremely high. Doctor-recommended solutions. The solution is not to avoid picking things up, but to relearn how to do it with a technique that protects your back and your balance. Doctors and physical therapists advocate for one golden rule, the golfer's lift or the hip hinge. The golfer's lift, For very light objects, this is the ideal technique for picking up a tissue or a light towel. Stand with your feet shoulder-width apart. Place one hand on a stable support surface, the bathroom counter, the vanity, a properly installed grab bar. This is crucial for balance. Keep your back perfectly straight, as if you have a board tied to it from your head to your tailbone. Slightly bend the knee of the leg you are not standing on, letting that foot come off the floor behind you. Hinge forward from your hips, not your waist, allowing your supporting hand to take most of your weight. Your back remains straight throughout. Grab the item and return to a standing position by pushing with your legs and using your arm on the counter for support. The full squat. If you need to reach something lower, use a full squat. Stand close to the item. With your back straight and chest up, bend at your hips and knees as if you are about to sit in a chair. Lower yourself down, using your leg muscles, the strongest in your body, to do the work. Keep your heels on the floor. Once you have the item, push through your heels to stand back up, again keeping your back straight. The ultimate tool, a reacher/grabber tool. This is the safest option of all. Keep a lightweight reacher tool in your bathroom. This ingenious device allows you to pick up items from the floor, reach for something on a high shelf, or even pull up your pants without ever bending over or losing your balance. It is a minimal investment for maximum safety and independence. Retraining this deeply ingrained habit requires conscious effort, but it is one of the most effective ways to protect yourself from a life-altering back injury or a devastating fall. By using your legs, hinging at your hips, and always supporting yourself, you safeguard your mobility and your independence. After addressing the physical dangers of movement, we must turn to a threat that is invisible to the naked eye, a danger that grows in the one place meant to cleanse us. The next habit creates a breeding ground for a microscopic enemy that poses a severe risk to senior health. We've addressed the major physical hazards: falls, heart strain, and back injuries. But now we must confront a danger that is invisible, silent, and multiplies in the one fixture we use most: the toilet. Habit number 4. Neglecting toilet hygiene and using harsh chemicals to clean it. This isn't about aesthetics. This is about infection control. For a senior, particularly one with a compromised immune system or underlying health conditions, a dirty toilet isn't just unsightly, it's a reservoir for pathogens that can lead to serious, even life-threatening, illness. The bacterial breeding ground. The toilet bowl, by its function, is a prime environment for certain bacteria and viruses. Moisture, organic matter, and room temperature create an ideal incubator. While normal cleaning handles most everyday germs, neglect allows more dangerous strains to thrive. Two of the most concerning culprits are C. difficile, Clostridioides difficile. This is a bacterium that causes severe diarrhea and colitis, inflammation of the colon. It is notoriously difficult to kill because it forms spores that can survive on surfaces for months. These spores are resistant to many common household cleaners and even alcohol-based hand sanitizers. C. diff infections are a major healthcare-associated risk, but they can easily be brought into the home. For an older adult, especially one who has recently been on antibiotics, which wipe out the good gut bacteria that keep C. diff in check, an infection can lead to devastating dehydration, sepsis, and is potentially fatal. The primary route of transmission? The fecal-oral route, often via contaminated hands touching surfaces like a toilet handle or seat. Coli, Escherichia coli. While many E. coli strains are harmless, some, like E. coli 0157, H7, produce toxins that can cause severe abdominal cramps, bloody diarrhea, and vomiting. Like C. diff, it spreads through fecal contamination. For seniors, the dehydration from such a violent illness can quickly become a medical emergency, stressing the kidneys and heart. The act of flushing, especially with the lid open, creates an invisible phenomenon known as toilet plume. This is an aerosolized mist of microscopic water particles and whatever else is in the bowl, which can be propelled several feet into the air, contaminating nearby surfaces like the floor, vanity, towels, and even your toothbrush. The danger of the clean, harsh chemical hazards. The obvious solution is to clean, and clean often. But here, another dangerous habit emerges: the use of overly harsh, fume-heavy chemical cleaners in a small, poorly ventilated space. Respiratory irritation. Ammonia and chlorine bleach release strong fumes that can irritate the lungs and airways. For seniors with pre-existing conditions like COPD, asthma, or emphysema, inhaling these fumes can trigger bronchospasms, coughing fits, and severe shortness of breath. Chemical burns. Concentrated bleach or acidic toilet bowl cleaners can cause serious chemical burns to the skin and eyes if splashed. Aging skin is more vulnerable to such injuries. Dangerous interactions. A catastrophic mistake is mixing chemical cleaners, most notably mixing bleach with ammonia. This combination creates toxic chloramine gas, and mixing bleach with acids, like those in some bowl cleaners, creates deadly chlorine gas. Exposure to these gases can cause permanent lung damage, pulmonary edema, and death. Doctor-recommended solutions. Staying safe requires a two-pronged approach. Effective cleaning without self-endangerment. The non-negotiable lid rule. Close before you flush. This is the simplest and most effective way to contain the toilet plume. Make it a non-negotiable habit to close the lid every single time you flush. This dramatically reduces the spread of airborne contaminants throughout the bathroom. Choose safer, effective cleaners. You don't need industrial-strength chemicals for daily maintenance. Distilled white vinegar. A natural acid that dissolves mineral deposits and has antimicrobial properties. Let it sit in the bowl for 30 minutes before scrubbing. Baking soda. A mild abrasive that helps scrub away stains and deodorizes. Hydrogen peroxide. 3% solution, an effective and less toxic disinfectant than bleach. If you use bleach, always dilute it according to package instructions. Ensure the room is well ventilated, open a window, turn on the fan, and never, ever mix it with any other product. Use the right tools. A good toilet brush with a holder that allows it to drain and dry prevents it from becoming a source of contamination itself. Disposable disinfecting wipes, like ones with benzalkonium chloride, are excellent for quickly wiping down the toilet seat, handle, and exterior surface after use. This is an easy habit that significantly reduces surface pathogens. Protect yourself while cleaning. Wear rubber gloves to protect your skin from both germs and chemicals. If you have respiratory issues, consider wearing a simple dust mask while using any spray cleaners to minimize fume inhalation. Read labels carefully and follow instructions. Toilet hygiene is a critical pillar of preventive health after 70. By closing the lid, choosing smarter cleaning agents, and maintaining a simple routine, you protect yourself from invisible threats that could land you in the hospital. It's a defense built on diligence, not strength. Finally, we come to the last habit. It happens at the sink, in a moment of quiet routine. It's a simple act of organization that, when done wrong, can lead to a mistake with grave consequences. The danger is not in the bathroom itself, but in what we keep there. We have arrived at the fifth and final dangerous habit, one that is deceptively simple and almost universally practiced: storing medication in the bathroom. For generations, the mirrored cabinet above the sink has been called the medicine cabinet. But doctors and pharmacists now issue a stern warning. This is arguably the worst place in your house to keep your prescriptions. Habit number 5. Storing medications in the bathroom cabinet. This common mistake creates two significant risks: the danger of chemical degradation of the drugs themselves, and the much more immediate peril of a medication error. The hostile environment of the bathroom. Your bathroom is an environment of extreme fluctuations. Every shower, every sink use, creates a cycle of heat and humidity that is utterly destructive to the stability of most medications. Heat. Many drugs are designed to be stored at room temperature, which is typically defined as 68 to 77 degrees Fahrenheit, 20 to 25 degrees Celsius. A bathroom can regularly exceed this, especially after a hot shower. Heat can break down the active ingredients in medication, making them less potent or completely ineffective. For a life-saving drug like heart medication or insulin, this loss of potency can have dire consequences. Humidity and moisture. The steam and moisture in the air are equally damaging. They can cause pills and capsules to soften, crumble, or dissolve prematurely. They can degrade transdermal patches and ruin inhalers. This not only affects the drug's efficacy but can also alter its release rate, leading to an accidental overdose or underdose. Storing medicine in the bathroom essentially guarantees that your drugs are exposed to conditions that can render them unreliable and unsafe to use. The peril of proximity, the medication error crisis. The second and more acute danger is the risk of taking the wrong pill or the wrong dose at the wrong time. The bathroom cabinet encourages a chaotic and risky storage system. The jumble, it becomes a catch-all for multiple family members' medications, often mixed in with old, expired prescriptions, dental floss, bandages, and makeup. This clutter is a breeding ground for mistakes. Similar bottles. In a rushed moment, perhaps with poor lighting or without your reading glasses, it is dangerously easy to grab a similar-sized white bottle of blood pressure medication when you meant to grab your allergy pill. The urgency factor. The middle of the night is a common time for needing medication. Fumbling in a dark bathroom cabinet, half asleep, significantly increases the risk of an error. For an older adult who may be managing multiple chronic conditions with a complex regimen of pills, a situation known as polypharmacy, the consequences of a mistake can be severe. Taking a double dose of a blood thinner could lead to internal bleeding. Missing a dose of a heart rhythm drug could trigger an arrhythmia. Taking a diabetes medication at the wrong time could cause a dangerous hypoglycemic event. Doctor-recommended solutions. Safeguarding your health means storing your medications wisely and managing them meticulously. The new storage rule: cool, dry, and dark. Find a new place for your medications. The ideal spot is a kitchen cabinet away from the stove, sink, and any hot appliances. A bedroom drawer in a nightstand. A dedicated closet shelf. The key is consistency. Always keep them in the same, safe place. Invest in a pill organizer, dosette box. This is one of the most powerful tools for medication safety. A weekly pill organizer with compartments for each day, and often times of day like AM/PM, allows you to sort your pills once a week, typically with a clear mind. This eliminates the daily guesswork and drastically reduces the chance of missing a dose or taking one twice. For those with significant visual or dexterity challenges, automated pill dispensers with alarms and locked compartments are available. The Great Purge: dispose of old medications. Regularly go through your medications and safely dispose of any that are expired or that you no longer take. Do not hoard old antibiotics or painkillers. Most pharmacies have take-back programs, or you can follow FDA guidelines for disposal at home, mixing with unpalatable substances like coffee grounds or cat litter in a sealed bag. Light and glasses. Create a routine. Never take medication in the dark. Always turn on a light. Always put on your reading glasses. This simple, non-negotiable ritual is your final check against a potentially tragic mistake. By moving your medications out of the hostile bathroom environment and into an organized system, you transform a daily risk into a simple, safe routine. You ensure the drugs you depend on remain effective, and you protect yourself from the silent threat of human error. This final change completes the transformation of your bathroom from a hazard zone into a sanctuary of safety. And there you have it. The 5 dangerous bathroom habits that every individual over 70 must break, according to medical experts. The unsupported step out of the shower. The excessively long hot shower. Bending over from the waist. Neglecting toilet hygiene and using harsh chemicals. Storing medication in the bathroom cabinet. Aging is a privilege, a journey of a life lived and lessons learned. But it also requires us to adapt, to become smarter about how we navigate our world. The home should be a place of comfort, not of hidden danger. Implementing these changes is not a surrender to age. It is a declaration of intelligence and a profound investment in your own continued independence. It's about making a few strategic adjustments to ensure that you can enjoy your home and your life with confidence and security for years to come. Talk to your family about these risks. Share this knowledge. A few simple modifications can make all the difference in the world. Here's to your health, your safety, and your freedom. Your safety and independence are priceless. If this guide brought you value and opened your eyes to the hidden dangers in your home, please do us a huge favor. Smash that like button and subscribe to our channel for more vital content that empowers your health and well-being. This information is too important to keep to yourself. Share this video with your friends, your family, anyone you care about who is entering their golden years. You could literally be saving them from a life-altering accident. What was the most surprising habit for you? Let us know in the comments below. And tell us what other health topics you'd like us to cover next. Thank you for watching. Stay safe, stay strong, and we'll see you in the next video.